It looks like it's a lot better. And we're live. Let me see. Okay, this is good. All right. Good morning,
Awesome.
everyone. Good morning, good afternoon, good evening, depending on when and where you're watching this Facebook Live. This is the voice and face of Dr. Tolu Olabinto, and I'm the CEO and co-founder of Living Spring Family Medical Center here in Mansfield, Texas, where we believe in helping our patients live long and well because we believe the quality of life is just as important as the quantity of life. Okay, I'm hearing a little bit of an echo. Can you hear it?
I can hear it. Yeah, it just started.
Okay, let's see if we can fix that. I think you're using the ear set before.
Should I put the set back on?
Yeah, let's try it and see because I can hear a lot of echo. Hang in there, those of you who are watching. Yeah, it's better, but now I can't hear you very well. But I can kind of hear you.
I have the volume all the way up, so I'm not sure why.
Okay, there we go. That's better. So that's good.
Okay.
Okay, so that's better. I just need you to project a little bit, but thank you so much for doing this. And for those who are watching live, hashtag live, those who are watching replay, hashtag replay. And we're having conversations to do today because we believe in helping our patients live a better quality of life and quantity of life. And today we're talking the topic, Doc, I have diabetes. How do I count carbs? And we're having talks with a nutritionist. It's nice to meet you in camera.
To meet you, yes.
Oh my goodness. So for those who are watching who are like, okay, who are you and what do you do?
So my name is Heather Di Stefano. I'm a registered dietitian. I'm getting an echo myself now. So I'm a registered dietitian. I've been a clinical dietitian for over 17 years now. I'm the owner of Practical Nutrition LLC, which is a private practice just outside of Dallas, actually, but I see all Dallas residents. I work alongside two other dietitians who have equal to or more experience than I do. We each have our own specialty areas. So I specialize in diabetes and weight management. I also do more clinical type stuff like tube feeding. So home tube feeding, I do a lot of chronic kidney disease. And then I also have a couple other dietitians, like I said, who do eating disorders, intuitive eating as well. So we have a lot of different specialty areas and we can help you with just about anything.
Awesome. And I appreciate what you do. My clients who have seen you appreciate your services and are doing and making better choices based on their conversations with you. So thank you.
Great. That's good to hear.
Awesome. So I always like to ask this question. What got you into this? Why do you do what you do?
So, well, it's kind of a long story, but basically when I was going to school, I went through a couple of different majors, and my sister-in-law at the time, she noticed that I had a lot of interest in fitness and nutrition. And she said, well, why don't you just take an elective course in nutrition? I think you might really like it. And I didn't even know there was such a thing as a registered dietitian back then, of course. And so I just decided, well, I'm just going to go ahead and take this course and see what happens. And I ended up really liking it. And so I ended up just majoring in human nutrition and food science. And it all just went from there. And I love what I do. I help so many people with what I do, make their diet and lifestyle choices and changes. And it's just really impactful to their overall health. So, but yeah, it went back to my childhood basically as well, because I grew up doing a lot of baking, a lot of cooking with my mom, a lot of working out with my mom, walks, weightlifting, that kind of stuff. So I had always had kind of an innate interest in the area.
Awesome. I saw your face light up as you explained like how you got into it. So clearly you're passionate about what you do, and I love it. And I love how you help our clients, help patients use food as medicine, and teaching them how to maneuver the different options. So awesome. So my next question to you is this, because we're talking carbs. Carbs are delicious.
Yes, they are.
but diabetes is a conundrum. And so first question is, why is it important to kind of count carbs, or at least to monitor your intake of carbs as someone who's diabetic? What would you say to that?
Sure. I get the question a lot. When patients are referred to me, they kind of come to me thinking that I'm going to tell them that carbohydrates are bad and to not eat them. And it's a very nuanced subject, but it's important for people to count their patients with diabetes specifically to count their carbohydrates, because carbohydrates are directly turned into glucose or blood sugar. And that is what causes blood sugar spikes and insulin spikes. So, and there's nothing wrong or abnormal about blood sugar spikes, right? It's a natural physiological reaction. But, with diabetes, we just need to be a little more conscientious with the amounts that we're taking in, and make sure that we're not overdoing things, because it's really, really obviously easy to overeat carbohydrate rich foods. Of course, it's much easier to eat, a lot of crackers, a lot of chips, versus a lot of, overeat chicken breast or overeat tuna or something like that. So just to manage the overall blood sugar is obviously really important with diabetes, and just knowing what foods are affecting someone's blood sugar can help them go a long, long way. And unfortunately, a lot of people come to me with bad information or something they've read online or an article they read, and they think, I can't eat any carbohydrates. And they're only thinking of, they're not thinking about all the foods that do contain carb, milk and vegetables and starchy vegetables and the healthy foods as well. So they've completely eliminated those foods from their diet. And then they're very confused with how it all works. So I really enjoy going through that with them and making sure they have a good, fair understanding of how it all comes together.
Awesome. And I like how you emphasize the fact that we do need carbs. The whole idea is not to avoid carbs, because carbs, glucose, one of the building blocks for oxygen transfer around the body. We need oxygen to live. So carbs are important. We just got to manage them a little bit differently in diabetes.
Exactly.
So my next question to you is this. Now, how do you calculate carb count? Now, I know that's a loaded question, but generally speaking, for someone who says, look, I don't want to have to put a microscope over everything I eat, but is there a general rule to help me? What would you say to that?
So basically what I do is, depending on somebody's goals, what their blood sugar is doing, do they need to lose weight? Do some people just need to maintain their weight? I take their weight in kilograms, and then I calculate how many total calories they're going to need. Whether that's, if, like I said, do they need to maintain their weight? Do they need to gain weight? Do they need to lose weight? And a lot, in most cases, people will need to lose weight, especially with type 2 diabetes. So I'll calculate their calories based on that. And then I'll divide that, or I'll take a certain percentage of, typically about 40 to 50% carb. And then I'll divide that by 4 to get the grams of carbohydrate that they're going to need per day. And then depending on how many meals they're eating, some people only eat 2 meals a day. So I'll kind of divide that out and see how many grams of carb they're going to need per meal or per snack, or however their typical eating pattern is.
Okay, so someone's watching this at like grams, carbs, convert 40%, 50%. I hated math. Still don't like it now. I love math, by the way. Sorry, that's a separate topic. But so someone who's watching is like, I'm already starting to see stars because you're talking numbers. And what would you say to that person? Because it sounds to me like everything is customized.
Oh.
Yeah, they're like, what? I have to start doing math with every meal? What would you say to that?
So that's how I calculate their carbs. And when I speak to them, I just say, look, all you need to worry about is eating this many grams per meal. And those are basically, I take that information and I say, instead of worrying about grams, let's look at the portion sizes of the foods that we're eating, and so we'll talk about portion sizes and looking at things on a plate. So I have like a plate that I show them, and I'll say, look, if you've got about this amount here, and like the hands and stuff. So I'll go through all that. And then once they get a little bit more comfortable with that, and they want to know more about the grams, like maybe 2 or 3 visits down the line, then I can say, okay, this is equivalent to about this many grams, and this is how we read the nutrition label. So it's, over time, it's something that we'll achieve, but you don't need to worry about necessarily counting exact numbers. No, I don't want to scare anyone, no, but that's how I calculate the grams.
All right, awesome. So for those who are watching, I hope you're encouraged. Don't scare away from finding out ways to, identify, even with eyesight or little markers like your fist size, lemon size. There are ways to make that relatable to you. So don't scare away. All right, next question. Is it advisable to avoid carbs? I know we talked about this earlier, but for someone who's diabetic, like, oh, I do a no carb diet. What are the risks? Like, why would you say that's not a good idea?
So yeah, I get that question actually quite a bit. So it's definitely not advisable to avoid carbs, just because you don't want to take a whole macronutrient out of your diet. Okay, you don't want to take all carbohydrates out of your diet, just like you wouldn't want to take all protein out of your diet or all fats out of your diet. It's the same thing with carbohydrates. And with diabetes, especially those who are taking insulin, you definitely don't want to avoid carbohydrate sources, because that's what's helping keep your blood sugar up. So, and it's nearly impossible to completely follow a no carbohydrate or an extremely low carbohydrate diet. It's definitely not sustainable, and it's not healthy. We have to remember that carbohydrates are what help us, obviously maintain blood sugar, maintain energy levels throughout the day, help us think throughout the day. And one thing that people don't think about with carbohydrates is they're what help preserve our lean body mass as well. So we want to maintain our musculature, especially as we get older. And if we severely cut carbohydrates out of our diet or reduce them significantly, then we can risk losing our lean body mass over time. So that's something that, I think a lot of people don't think about, but very, very important. Actually, most of our calories should be coming from carbohydrate sources. So looking at, let's say, a 2,000 calorie diet, we want about 800 to 1,000 calories coming from carbohydrate sources. So very important to have those included.
Okay. And I like that you said there are a lot of sources of carbs. They're also in vegetables. So someone's watching and say, okay, can you give me a general idea? We agree that all carbs are not bad. What carbs should I lean towards and which ones should I lean away? And is there a general rule?
So that's a very nuanced question. Of course, that's something that I love when I meet with patients, is to explain, what are carbohydrates and what are the sources of carbohydrates and what are good choices and not as good a choices. So to answer the question, I think most people think of carbs as being just sugar, yeah, sugars and sweets and things like that. And so, obviously we want to minimize those concentrated sweets. I call them concentrated sweets because they're, loaded with typically added sugars, okay, or table sugar, white sugar, as you might have heard. So your concentrated sweets are going to be like cookies and cakes and donuts, but also things like juice. Even 100% juice is considered a concentrated sweet. So, and in the management of diabetes, it could be just as simple as really minimizing those concentrated sweets to get your A1C under better control. It could be just something really small like that needs to be adjusted. So it doesn't have to be a whole entire lifestyle change to bump the A1C down a little bit. So I think that's kind of exciting as well to learn.
Okay. What about grains? So let's talk grains a little bit. Now that we know that carbs come in finding different things, we want to ward away from, or kind of lean away from the concentrated sweets, your sodas, your juices, your juices, your fruit juices, loaded actually. So grains in general, are there any tips? Okay, what grain should I choose? What's the deal with white rice? I like white rice.
Yes, we all love white rice. Yeah. And really, at the end of the day, it all affects your blood sugar, whether it's a high fiber food like a brown rice or whole grain bread. They all affect your blood sugar. But because of the fiber content of like the whole grain breads and the whole grain products, it's lessened a little bit in terms of how much it affects your blood sugar. So we all count them as carb. However, they just affect your blood sugar a little bit differently. So, but in terms of grains, we definitely want to lean toward more of a whole grain type of foods. And those are pretty easy to identify nowadays because they're labeled whole grains
Right.
right on the label, you know. And then I also go through with patients how to look at the ingredients list, make sure that, you know, it's whole grain listed as instead of enriched flour or something like that. Yeah. So it's just a very small thing to look at, but a huge impact on your health.
I agree. And one of the things I've had to try to, to give tips to my clients is when you're trying to buy bread, just because it says wheat bread doesn't mean it's whole wheat bread. A lot of times you can tell it's high fiber, and that's what we're encouraging here. High fiber carb, because it gets your sugar, takes your sugar up, but keeps it steady, as opposed to simple sugars that shoot your sugars really high. But when you're getting the bread, look for the ones that have things in it. You could actually see the nuts and the grains and the wholeness of it, as opposed to the ones that have the enriched flour. Because a lot of people go buying wheat bread thinking that, oh, I'm eating healthy, when you're not. Those breads, the healthier ones, tend to be a little more expensive, and you could actually see the things, the fiber in it. So that's how you can also tell that something is off. I'm hoping and I'm trusting that this conversation is encouraging people, and I'm so happy that you're here and you answer these questions. Thank you for taking the time. And my next question to you is this: for someone who's wondering, you know what, I need a nutritionist. I need someone who will sit with me and kind of come up with a customized plan unique to me, my culture, what I enjoy eating, what's available to me, and explain in a way that I can understand so I can make better decisions when it comes to my health, diabetes. Where can people find you? That's all I was, all of that to say.
That's okay.
Where can people find you?
So they can find me. Do you want me to put the phone number?
You could give a blow. We're going to put it right here. Anyway, go ahead.
Okay. So the office phone number is 682-564-2381. They can contact us directly for an appointment. The other really easy way to get in contact with us is to go online at www.practical-nutrition.com. And you can schedule your appointment right there. You know, if you have any questions before you schedule your appointment, please reach out. You know, we're here to help you. I will be seeing, right now we're all virtual, but I will be taking in-person clients again about mid-May again. Okay. So if you want an in-person appointment, I will be available starting mid-May, and the location is in Arlington. So awesome. Yeah.
Awesome. And we'll put all that information at the there it is. That's your website, and there's the phone number. And once again, thank you so much for what you do for my clients here in Mansfield, Texas. And I look forward to having this conversation with you again, maybe in a couple of months.
Great. Well, thank you so much for having me.
My pleasure. My pleasure. All right. Thank you all for watching. Please, as always, share this video with others. You can simply tag them in the comments or just forward this video to them. And if you or anyone you know is looking for an awesome, a thorough, and a passionate family physician in the Mansfield, Texas area that will have conversations to help you live long and well, I am she. Happy Tuesday, everyone. Thank you so much, Heather. I appreciate you.
Bye.
Bye.